Hello, my name is Skyler. I'm your student nurse today. Can you please state your name and date of birth for me, please? Mickey Mouse, April 3rd, 1983. Okay, I'm going to go ahead and look at your armband. Mickey Mouse, April 3rd, 1983. Okay, perfect. I'm going to go ahead and finish washing my hands for 20 seconds. And I see that you don't have an allergy bracelet, but I just want to ask, do you have any allergies? Specifically to chlorhexidine, latex, or tape? No? Okay. Do you have any pain right now? No pain? Okay, so today we're just going to change your CVAD dressing, which is a central venous access device. And that device, that catheter or tube that you have on your chest right now, it allows us to push fluids and medications through in line with your heart so it can pump throughout the rest of your body much quicker. So it's my job to change that dressing every 7 days to prevent infection, also known as a central line associated bloodstream infection, which is a very nasty infection that we don't ever want you to have, okay? So it's important for us to change your dressing every 7 days. Have you ever got your dressing changed before? Yeah? And it was painless? Yeah? Okay. So this is painless, but if you do ever experience any pain throughout the procedure, I just want to let you know to tell me, and we can go ahead and stop and take a break, okay? So I'm going to go ahead and start now, but before I do that, do you have any questions or concerns? No? Okay, I'll go ahead and start then, okay? I'm going to wash my hands for 20 seconds. I'm going to put on some clean gloves. Clean gloves here. And we're going to go ahead and prepare our workspace first. So we're going to wipe down the table for 30 seconds. Just got these on. Okay, we're going to wipe the table down for 30 seconds. You have anybody coming visiting you today, Mickey? Minnie Mouse is visiting you today? Okay. What was that? Oh, you want to go have a picnic outside? Yeah, it's nice and sunny outside. It's a great time to have a picnic. So hopefully you get discharged today. Let's hope. You miss Pluto, your dog? I love dogs too. So I'm going to continue to wipe this down for 30 seconds and then we'll try to finish up as quickly as we can, okay? Okay, just make sure I wipe this down. I'm going to go ahead and wipe the edges too. Get every edge here. Let's get in the middle of these. Alright, perfect. Now I'm going to go ahead and throw this away. I'm going to remove these gloves. I'm going to let these air dry for 2 minutes. I'm going to perform hand hygiene. And I'm going to bring our necessary supplies, which is a CVAD dressing kit and a bio patch. So I let this dry. Now I'm going to place them here. But before I proceed, I just want to ask you a quick question, Mickey. Are you in a comfortable position right now? You are? That's good. For the rest of the procedure, I'm just going to have you turn your head to the side so we can prevent contamination and infection of the site while I'm changing it, okay? So I just want you to turn your head to the side. Perfect. Okay, so I'm going to perform hand hygiene for 20 seconds. Now I'm going to open the tray carefully, touching the borders. And since Mickey is already wearing a mask, I'm going to put on a mask since I'm not wearing one. And we both need to be wearing a mask. So let me put this on. Okay. Alright, now that I have my mask on, I want to carefully grab the sterile gloves from the container, put it to the side, and then I'll grab the bio patch. And carefully drop it into the tray. Perfect. Now I'm going to throw this away. I'm going to perform hand hygiene for 20 seconds. Alright, Mickey, we're going to go ahead and change and remove that old dressing, okay? And then we're going to clean it and apply a new one for you, okay? I'm going to put on some clean gloves. Okay. I'm going to go ahead and reveal your chest for a bit. Is that okay? That's fine? Okay. So I'm just going to show the chest area, only the site. Not going to reveal you anywhere else, which is perfect. Okay. So I'm going to go ahead and remove the dressing now. I'm going to just stabilize your catheter here while I remove it. Just let me know if you experience any type of pain, okay? Are you in any pain right now, Mickey? No pain? Okay. Perfect. I'm just going to continue to remove this. And then just let me know if you experience any pain. I'll just go and remove this dressing for you. Get the detacher from this tube here, stabilizing it. Perfect. Almost done. And there we go. That wasn't so bad, right? So I'm going to go ahead and throw away the old dressing. I'm going to remove my gloves. I'm going to perform hand hygiene for 20 seconds. Now I'm going to assess the site. So there's no redness, no swelling, no signs of infection. The catheter is not leaking. No cracks. That's good. Also, the catheter is in the right position according to the documentation. And also, yep, there's a black line there. That's the correct length, documented by the previous nurse, which is perfect. So now we're going to go ahead and clean that site and apply a new sterile dressing for you, okay? So now I'm going to perform hand hygiene for 20 seconds. Okay, and now we're going to go ahead and open this up carefully, only touching the 1-inch borders of this. Make sure that's nice and open. Perfect. Okay, now we're just going to flatten this a little bit. Okay, right there. Now we're going to grab this glove right here, only touching the cuff. I'm going to point it away from me. And we'll put this on. Okay. Nice and slow. Alright, so let's pinky there. Okay. So we'll fix that later. I'm just going to go ahead and put this in for now. And grab this one. Okay, we got that. I'm going to go ahead and put this hand in. Okay. Now I'm going to go ahead and actually release this cuff right here, which is fine. I'm going to go ahead and fix my pinky here. Fix it. Go ahead and fix my pinky and all the rest of my fingers. Alright, perfect. Now I'm going to go ahead and release this cuff and pull it here. Perfect. I released both cuffs. I'm going to go ahead and carefully lift this and throw it to the side like so, like that. Now I'm going to go ahead and take away the unnecessary stuff from here, so we don't need that. Okay. I don't need this. And my bio patch did flip over, so the white side is facing up, so I'm going to go ahead and try to flip that over with this one. Okay. Let's go ahead and try to flip that over. Let's just keep this here. Alright, there we go. Okay. Now that's flipped over to the blue side up. I'm going to grab the tegaderm so we can prepare it, so it's easier. There we go. I'm going to open it up here. Just fold it right there so we can grab the sticky side later. Carefully place it back in. Okay, Mickey, we're going to go and clean your site now, okay? So I'm going to go ahead and carefully grab the CHG swab. We're going to crack it. Now we're going to grab the hub here, point it away from the site for a bit, and we're going to go ahead and clean the 2-inch borders here, okay, for 30 seconds. You feeling any pain, Mickey? No pain? That's good. Just continue to wipe this side. Okay, every side, all 4 sides here, around the site. Okay. Perfect. Okay. Now that I cleaned the skin for 30 seconds, I'm going to go ahead and clean the catheter from bottom to top, bottom to top, bottom to top on all sides. Okay. Okay. Just making sure everything's clean. Perfect. Now we're just going to keep it right here for a bit. We're going to go ahead and throw this away over here. We're going to grab the bio patch in our tray here and fold it into a taco. And then carefully place it inside so the catheter is in the middle. Okay, now it's in the middle, perfect. Now I'm going to grab this tegaderm right here. I'm going to have my right hand grab the non-sticky side while my sterile hand grabs the sticky side. I'm going to remove it from there. I'm going to form the loop. Perfect. Put it in the middle. Okay. Okay. Site isn't in view. We're going to go ahead and remove this. Make sure there's no air bubbles. Perfect. I'm going to go ahead and write the date, time, and my initials. Which is 10/23/2023. Today, the time is 15:03, and my initial is SR. Perfect. Okay, now we're going to go ahead and remove this. Okay. Now we're going to tape it on right there. Okay, and I also noticed that your catheter is dangling a bit, so we're going to go ahead and tape it for you there. Okay, we go ahead and do a butterfly right here, so there's not too much pressure on you. There you go. Okay, so I'm going to throw away this stuff. Throw them away. I'm going to go ahead and assess the site. No cracks, leakage, correct placement of the catheter, correct length. Perfect, no signs of infection or redness or swelling. Good. I'm going to go ahead and cover you up now. Are you in any pain, Mickey? No, you're all good? Perfect. So right now I'm going to go ahead and document the date and time of the procedure, also the length of the catheter, also the patient's tolerance, which is he was tolerating it, and the site assessment as well, okay? So now we're going to document that. Is there anything else you need from me? No? Okay, well, your call light is right there, so you can go ahead and call me when you need me. I'm going to go ahead and go now, okay? So I'm going to remove these gloves and perform hand hygiene for 20 seconds.